Hi friends, today I am going to talk to you about a common gynecological cancer. So when I talk about uterine cancers, there are three main types which you should be aware about. One is the cervical cancer, the other is the uterine cancer, and the third one is the ovarian cancer. Why we should know about these three types of cancers is that the type of cancer which comes in each location is totally different. For example, a cancer which comes in the cervix is a squamous cell carcinoma, and the cancer which comes in the uterus is a endometrioid carcinoma, and the cancer which comes in the ovary is an adenocarcinoma. Why we should know about the types of cancer is the way these cancers behave and the treatment options for them are totally different. So now coming to the common symptoms which a patient would have if they are having one of these cancers is that they will complain of either bleeding per vagina or excessive bleeding during cycles. A lot of patients post-menopausally, if they have any bleeding and if they have some vague pain or white discharge in the lower abdomen, or if they have any fullness in the abdomen, these are the common signs which we see in these cancers. So one has to be very prudent whenever you see these signs in these cancers. So when you have a doubt that you have these signs and whether you want to know whether it's a cancer or not, the next thing you should do is go to a doctor. A doctor would do an examination of your abdomen and also a pervaginal examination. If it is an ulcer or a growth from the cervix, just by the pervaginal examination we can identify it. Whereas if it is a problem with the uterus or the ovary, the doctor will advise a basic test like an ultrasound abdomen to rule out. Once we do the test and we find out that there is a suspected growth, the next thing we should do is take a biopsy, which means removing a few cells from the growth and sending it for histopathological examination. Once this biopsy comes positive for cancer, the next thing we should do is stage the disease. Commonly we would ask for a CT or MRI based on where the cancer is present. Once we do the staging, this is called as a radiological staging, and if the stage is an early stage, then we would suggest the patient to undergo surgery. If it is an advanced stage, then they will have other forms of treatment which would be given initially, which I will talk to you in a little later portion in the same video. So when we say surgery, what type of surgery we perform is, we remove the entire uterus, we remove both ovaries, and we remove the fallopian tubes. In addition to it, we remove the lymph nodes which are present along the major blood vessels on both sides, and we also remove what is called as the omentum in certain type of cancers. So once we remove all these structures, we would send this for histopathological examination. And once the report comes from the histopathological examination, we know the definitive pathological stage for the patient, and we generally follow this stage for further management and follow-up. When I say further management, what I essentially mean is, if it is an early stage cancer, then only the surgery would be good enough for the patient. Whereas if it is a slightly advanced stage cancer, then only surgery will not be sufficient. You will have to give them additional treatment. So commonly the two forms of additional treatments which we give are, one is called chemotherapy. Through injections we give medicines, and this will help to control the cancer and even cure it in certain cases. And the other type is a radiotherapy. Once again, based on the cancer type and location, we would either give one or both these treatments to the same patient. So once the treatments are over, patients commonly ask us whether they are cured of the cancer right now. You can only say a patient is cured of cancer when it has been 5 years since the completion of treatment and the patient does not have any signs of cancer. So during that 5 years, a strict follow-up is definitely essential, and we generally call these patients under remission. So next, after all the treatment is over, you have to just come to the doctor for basic clinical examinations and some form of imaging, either ultrasound or CT or MR based on what type of cancer and the stage you had. When I talk about surgery, sometime earlier we had only one option. We used to do an open surgery where we will cut open the abdomen, go into the abdomen and perform the surgery. Whereas now we perform all these cancer surgeries laparoscopically, and this is not something new. It has been performed for more than 25 years now, and this is the recommendation as well. So a lot of people have a misconception that in open surgery you can see everything and you will remove everything completely, whereas in laparoscopy surgery you can't do that. This is a very wrong conception. Whenever we are within a room, you can see only what is present around the room. Whereas if you are present in a helicopter and you see from the house, from the aerial view, you can see the entire house. So which means in laparoscopic surgery, because you can see the entire abdomen, this is definitely superior for a diagnostic purpose. And when you can see only one localized quadrant, the rest of the area can only be palpated, you can't visually see that. Second thing, the type of surgery will never vary when we perform it laparoscopically. The way we perform the surgery only will vary. So when we do a laparoscopic surgery, the advantage is that we do not have to cut open the abdomen. Only through 3 small holes we can perform the entire surgery, which is very comfortable for the patient in the recovery period. They will not have any major scars, they will not have a lot of pain, the blood loss is much less, and the return and recovery also is much more faster. I hope through this video blog I have clarified your basic doubts and this was helpful for you. If you have any more doubts, you can contact me at Ashwin Hospital. Thank you very much.